The literal translation of Nyaya is justice. That would be the most simple translation. I had read about a couple of districts in the far western part of the country called Doti and Acham, both of which are two of the poorest districts among the 75 districts in the country, have far and away the highest rates of HIV due to high rates of migration of men to India for labor. And also they had the worst health infrastructure. And so I had the opportunity to go visit those districts in early 2006. I interviewed a lot of women who had lost their husbands to HIV after they'd gone to India for work. And many of the women themselves were HIV infected, and kind of told us story after story of how they couldn't get medical care because they would have to take a bus 15 hours to the closest city that provided antiretroviral therapy at that time. And I was very compelled by what I saw. And on the last day that I was in Acham, I was taken to a hospital in a town called Bayapata, which is about an hour above the transportation hub for the district. And this hospital that we visited was completely abandoned, with 8 buildings that had been built 20 years prior by the government. And the plan for the hospital had been that it would be the district hospital for serving the entire district. But right after they finished building it, they decided to move the district headquarters to another town that was about an 8-hour walk away. And I went back to Kathmandu the next day and wrote to 2 of my friends, Sanjay Basu and Duncan Maru, and said, here's the situation, here's this hospital, this is what the district is like. It would be great if we could do something to try to raise some resources to renovate this hospital and fund staff to be there and try to kind of rebuild health services in this community in Acham. After 2 years with a lot of grant writing and technical planning and visits back to Acham, we had managed to renovate a primary health center, fully stocked the health center. We hired 20 Nepali staff members, 19 of whom were from the district of Acham, who we attracted back to Acham from working outside the district, and we had a fully functioning primary health center.
When I joined the team a couple of years ago, one of the things that I think is in particular special about Nyaya and Partners in Health in general, and similar organizations that work along those lines, are that they take as precedence that health is a basic fundamental human right. And when Jason was in Acham 5 years ago now, the glaring inequity, and in particular the glaring inequity within Nepal, as well as just more generally in developing countries across the board, was something that really spoke to, at the time, Jason and Duncan and Sanjay, and since then the entire Nyaya team.
One of our founders, Duncan Maru, had a term, Global Health Delivery 2.0, that he uses for this idea that he wanted us to really document, as we did this whole process, what does it take to develop a community health program, clinical service in a rural resource poor setting like Nepal, and to make that available so that people that are envisioning doing kind of a similar project can take that as a guide to learn from our experiences, for better or for worse. So we used a lot of internet and social media to try to get out, to share our experiences. Some examples of this are, we have a wiki on our website where you can read everything from our clinical protocols to our data of how many visits we have in any given day or any given week and what type of visits those are, to very technical things that people might not be thinking of, like how do you build an incinerator in a rural area without being able to have the right kind of bricks recommended by the WHO, or how do you wire an inverter so that whenever you lose electricity for 18 hours a day, as we do, you're able to still maintain electricity for critical functions. And you can go onto our website and read detailed protocols for how we did this, and the cases in which it's worked and the cases in which we've had challenges.
We don't have any expectation that we'll be succeeding or ameliorating any of the inequity in the near term. But the idea of partnership and accompaniment is important in our own work as well, and developing partnerships with local NGOs, with the local government, as well as working with the national government and the public sector as a whole. The intention there is to bolster what is there and to not create a parallel system, hopefully. To use a very cliched word, hopefully that will foster sustainability. Finding an organization that you feel inspired about and excited about, and then getting involved, but also making sure to look around the environment. Scan the periphery and see who else is doing what. The importance of collaboration at this point in the global health field, I think, can't be understated, and so I think it's just a question of finding what inspires you and starting out and seeing where it takes you, and always making sure you're looking to those who have come before.